One size smaller, maybe 5.5, 6, maybe 5. I'm here too. Oh, can go too. Check out the juice.
I'm not saying our laptop in my room because it's such an old system.
Laptop in here?
No, in my room.
It's
such an old system. It's not letting me log into things. And so I'm going to have to one of those. I'm going to convert. It's the same happen. Also, straight on these ones. And the other thing I say we should do is cover the little booties on the wall.
Can we just put cotton wool on a horse now? Oh, shit. So,
Are we near it ready or not?
just do it.
Oh,
Can you just put cotton wool on it? What's wrong with it?
And also, bubble wrap, just on the pads, but you've got to do your ties around it. I might have some comfort. Just clip around there too. No, that's good anyway.
Yeah, we look down there after.
I've already got my material. This is important. Okay, we've got sugar.
Yeah, go ahead.
Bakery. Size.
We've got between 5 and 6.5.
I reckon that one.
What did you say?
I got one. Sorry. Yes, stick that please. Could be. Look at his tiny nose. Who's leaving those? Look, that's pathetic. It needs to be long enough. I have to leave it around the back of that as well. We have to have it. Right, we're going on. Yeah. Is that it?
Yeah.
I'll just show you those. Nice control. So you have to, all by today. Right down here. I won't have legs. You're ready to just do your bit. You want to do pulse oximetry on, please. And tight.
Yes, pretty close. So, pretty more. hair looks clean from here. It looks clean from here. Don't forget to turn them on before you put them in.
Yeah.
They'll love you. Okay, Tom.
Very obedient. Okay. So, prior to bringing Charlie in for surgery, we advise that she does not have anything to eat from about midnight onwards. And she was allowed to have as much water as she likes, just no food. Do you want food?
Yeah.
Cool. Okay. So, surgery went well. Charlie has about 4 stitches that will need to be removed in about 7 to 10 days. We recommend that you offer Charlie a small amount of food about half an hour after discharge, and then another half an hour if she wants it, after another half an hour if she wants the food. It's important that she remains as quiet as possible until the stitches come out. She's allowed to go on short walks, but just no jumping or anything. She should have access to plenty of fresh water in the first 24 to 48 hours as she will be a bit sleepy, and rest is important. What else? Make sure that stitches don't get wet. And just keep an eye on them, make sure that there's no redness or swelling. If you do notice any of this, we recommend you bringing in Charlie to get checked. That's about it. Do you understand all that?
Sure do.
Cool. Thank you very much. When monitoring a patient's wound site, you're going to be checking for any blood loss, redness, swelling, itchiness, signs of infection, whether the stitches are coming loose or have any of them broken, stuff like that. Monitoring of the patient's wound site is done every 10 minutes-ish immediately post-surgery or the injury occurring for the first hour. Then after that you can extend that to every half an hour until discharge. Any abnormalities, like those previously mentioned, should be reported immediately to either the head nurse or the on-duty vet. This is so prompt action can be taken to solve the issue. Treatment and action may include administration of antibiotics or pain relief, stopping of blood, redoing stitches, or in a worst case scenario, reopening the patient or performing another surgery. Steps to performing IPPV. Step 1, you're going to turn the vaporizer off. Then you're going to disconnect the patient from the circuit and include the end of the hose. You're going to flush the bag to remove any excess vapors, close the pop-off valve, and then refill the bag with oxygen. Then they're going to open the valve, flush the bag, and repeat this 2 to 3 times until the system is flushed clean. Next, you're going to close the pop-off valve again, refill the bag, and then reconnect your patient to the circuit. Gently squeeze the bag, watching for the patient's chest to rise, making sure you're not overinflating the patient's chest. You're then going to open the valve and refill the bag again. Whilst doing this, you're going to watch the clock and watch the patient for breathing. If the patient hasn't taken a breath, you will repeat this every 10 seconds until the patient begins to breathe on its own. Assistance during surgery can be provided by both a scrubbed-in nurse or a non-scrubbed-in nurse. This will depend on the type of surgery and what type of assistance is required by the vet nurse. Examples of providing assistance during surgery include passing of sterile instruments to the veterinarian, using a cauterizer during a lump removal, or when any veins or arteries have been nicked by the vet and will require cauterizing. Holding of a patient's limb while the vet bandages, such as in a Robert Jones bandaging, and preparing and passing over of any extra instruments, particularly ones in a sterile bag. The vet nurse will have to cut the bag and hold it open so the vet can grab out the instruments without touching any non-sterile areas. Lastly, to set up a semi-closed circuit, rebreathing circuit, you're going to connect the F circuit to the valves with the main stem tubing. This is the one that connects to the patient, connecting to the inhalation inlet valve, and a shorter tubing connecting to the exhalation inlet valve. Setting up the rest of the system will be done as you would for a closed rebreathing circuit.